in modern Colourpuncture, what we do now, we don't do meridians, entry point, exit points anymore, because there are quicker and more targeted strategy of working with meridians. However, in some, because what you're referring to, stroking the meridians to open the meridian, to close the meridian, is the very beginning of Colourpuncture. This is how it started, and part of it was stroking the meridians to regulate. And from what I understand, originally it was only red and green, so it was extreme. It was basically red to activate and then the opposite color to come down. And generally green is a nice balancing color, so regardless if situation is chronic or acute or whatever, green would just balance. And in combination with red, it would provide an effect. Now, what you learned is obviously still valid. This is still good. However, the way we work now is on a different premise. So we are looking more into information source of things, if it makes sense, because with acupuncture, we mainly work with energies. With Colourpuncture, as it is now, we work more and more with information. Now, if you look at, for example, update seminars of the recent years, Peter Mendel is creating more and more therapies and approaches into treating therapy resistance, addressing the ancestry problems, addressing things which are very difficult, very obscure, and very hard to respond to your normal treatments. So we're moving more in a direction of crystals, UV, things which access those parts which can hold the key to the very, very root of a disease. That does not mean that our work with meridians should be forgotten. So basically, when we work with meridians, we're working with something, with a situation which is more here, now, present. Very often, this is either level of emotion, which is energy, or level of physical disbalance, physical illness, physical problems, pain, which is more physical, body disbalance. So we're working more on this side of the spectrum, not necessarily we are tapping into the informational part. So in your situation, because you have UV, you can work with UV in the sense to balance. The way we work with meridians now, for example, is more, we are asking a very limited question. So for example, classic, which I'm sure you know this treatment, it's a classic treatment, it's a part treatment for cold, common cold and flu. So this stroke, the very beginning, I'm quite struggling to show, looking at myself in this little window. So basically we take the very beginning of large intestine meridian and we stroke from large intestine 1 through large intestine 2 and 3 to large intestine 4 and back. So this way what is happening, so for those of you who are not familiar with meridian sort of structure, this is the very end, the very beginning of meridians. They are very sort of end points of things. So energy here is very, very shallow, very, very accessible. So when we treat something here, we normally want to, say in this particular situation, we want to, what is called, expel the pathogen. So if we have a type of cold or flu or something, on the first stage, we want to expel the pathogen out of the body. And the energy here is very shallow. Sorry, the meridian, the flow of energy, flow of chi in the meridian is very, very shallow. So we tap straight into it at this level. And what you need to remember about this particular line, in case you want to treat this particular line, so if you have a cold without temperatures and you use red to stroke, but when you already develop temperature or you start off with a temperature, you switch it to blue, because exactly the point that we made before, you either need to activate the meridian or we need to sedate it. So it's either or. And when we are talking about acute situations, then it's red or blue. When there is temperature, there is pain or something. You can use the same strategy, you can use the same approach if you would like to treat any other meridian. So for example, for argument's sake, if you have somebody with food stagnation, somebody just overeaten, they had, some food, you can treat the very end of the stomach meridian. So we are talking about, the area of from probably stomach 41 down to the end of meridian, or probably even 41, 45, you can just stroke, the toe itself, and it will give you the result. Now, how to choose the color? You need to test for sensitivity, and this is beauty of Colourpuncture and a big advantage in comparison with acupuncture. you palpate two sides. And for example, even when there is a stagnation of food in the stomach, person overate, and this is classic excess reaction, the bottom line is we still need to test both meridians and see what is happening. If one side is more sensitive, then in case of stomach meridian, we treat it in blue. Either side is less sensitive, we treat with orange. Because we both need to sedate, we need to calm down things, and we need to activate stomach function so it can actually process the food and everything. So we still use this. If, for example, both sides are very, very responsive, very, very painful, then you can use blue, blue. Or if both sides are absolutely non-responsive, you can use orange, orange. So you go with color indication. Color indication is such an interesting thing in Colourpuncture. It's so simple, so basic. We learn it on a day one. But this is something we come back to again, again, and again, especially if you want to create your own protocols, you want to be creative with color in general.